Hello all. In today's session with Sainik, we have Dr. Seema Rao. Dr. Seema Rao is the Director and Consultant in Palliative Medicine, Manipal Hospice and Respite Center, Manipal Academy of Higher Education. Formerly, Dr. Rao was Honorary Senior Lecturer at School of Medicine, Cardiff, United Kingdom. She has over 25 years of experience in the field of medicine, mental health, and palliative care, and has been associated with KMC Manipal since 2019. Dr. Rao, I welcome you to session with Sainik. Ma'am, thank you for coming on to this show. Basically, we are here to discuss on a very important topic on which people don't have much awareness. Why there is no awareness? Maybe because this topic is not as much as talked about. This is palliative care, hospice care, and respite care. So these are the topics which we want to touch upon today and understand from an expert in this field on what these are and how it is impacting the daily life of people who are here at this facility, and how should people make use of this wonderful initiative that Manipal has created for the people of Udupi and for the people who are around Udupi area, and come over here and utilize this facility, ma'am. So we will be touching upon these issues, ma'am. Ma'am, can you briefly explain when this facility was started and the intent of providing such a facility?
This is Manipal Hospice and Respite Center, as you rightly said. This is a social impact project of Manipal Academy of Higher Education. You're aware, Manipal Academy, MAHE, has been leaders in healthcare,
Yes.
Since quite few decades.
Yes, ma'am.
Right? So this facility was started as a giving back to the society.
Yes.
It is a facility which looks after patients who have chronic, life limiting, or life threatening illnesses. Right? When we say life limiting or life threatening, what I mean is patients with cancer, with patients who have kidney failure, neurological diseases like it could be Parkinsonism, dementia, stroke, or lung issues with lung, breathing difficulties, diseases with lung diseases. So any of those diseases which are chronic,
Yes.
which bring in a lot of suffering, we take care of such patients.
Okay. So when you say chronic, is the layman's understanding is they've been suffering from that from a long time.
Yes.
And now need care which may not be possible at home and require specialized treatment. Is that?
Treatment. Yes. So when we talk about palliative care,
Palliative
we talk about different aspects of care.
Yes, ma'am.
Okay. So when we say a chronic illness, we mean a illness that is present for a long
time.
Okay, and which is causing a lot of suffering
Mhm.
for the patient, for the family members, right? So, for example, when I talk about maybe cancer, right? Stage 1, stage 2, curable.
Curable.
But as the disease progresses, sometimes cure is not possible,
Mhm.
right? Those patients require a different type of care.
Okay.
So that is where hospice care comes
in. Okay.
Patients who are nearing end of life,
Okay.
where disease is not curable at all.
Okay.
It could be any disease where you cannot cure the disease.
Mhm.
You may not be able to control the disease.
Okay.
And the person has a limited lifespan. Lifespan could be anything. It could be 6 months or a year.
Yeah.
That phase is called as end of life.
Okay.
And that is where hospice care comes
in.
Right? These patients need a different type of care because it is not only the physical symptoms that we are looking after.
Okay.
We are looking after the psychological aspect, the social aspect, the spiritual suffering that comes with it.
Yes.
It is not only the patient. We look after the patient as well as the loved ones, the family.
The family.
So this requires a different type of care.
Yes.
And that is what we call hospice care. Right?
Got it.
When we talk about respite care, we are talking about again patients with chronic illness, but those who are not necessarily at the end of life.
Okay.
These patients simultaneously treatment for the disease is going on.
Okay, understood.
but they also have a lot of suffering,
Understood,
right?
ma'am.
Suffering in terms of pain or maybe psychological suffering.
Mm-hmm.
So these patients get, or they have nursing care is
Care.
required. They have some wounds that need to be, dressing of
This
wounds
is
is required, care of wound is required, or they need physiotherapy and
Mhm.
rehabilitation,
Okay.
etc.
Okay.
So such patients come to the
Respite
respite
care
center. They stay here for a short period of time, probably 1 week, 2 week, 3 week as
as
required,
required.
and we put systems in place for them. We
Okay.
take care of them. We teach the families how to take care
Take.
of the patient.
Yes,
And
ma'am.
when we have put the systems, they are both comfortable.
Yes,
We
ma'am.
then discharge them back home. And also we ensure that there is somebody in the local area that they are going back to,
Mm-hmm.
whom, and there is a doctor or some healthcare system is available for them to reach out to.
Reach out to.
So that is what we call respite care.
Understood.
Sometimes the caregivers are very tired taking care of their loved one. So
Mm-hmm.
coming to such a center, staying here for 2 days, I mean 2 weeks,
2 weeks
it sort of gives them some sort of a respite
respite.
for the caregiver. They sleep well. They
Okay.
know their loved one is taken care
Correct.
of,
Correct.
and they are. That is the concept of respite care.
Correct. So I think it's a very important point that you have brought out, because when a person is suffering from the diseases that you mentioned, which are very, terminal illnesses, it is not only the person but also his family members also who suffer.
Absolutely.
One is they are going through that emotional trauma of knowing that the person may not be with them for that much of time, and also the requirement of taking care of that person, where they will not be able to attend to their, if they are working. And I know instances where people have quit their jobs and, to take care of their loved ones. So that can cause, mental trauma as well. So you are telling them how to cope up with that
Yes.
as well over here.
Absolutely.
So, ma'am, many people are not aware of respite care, because the families or people who I have come across till date believe in taking care of their loved ones continuously, and they, like, that's the reason why we are having this
Conversation.
conversation, is they are not aware that there is a respite center and where respite care can be provided, which is going to be beneficial for the person who is suffering through that disease, plus the person or the people who are taking care of that individual, because it gives both of them a bit of space, okay, for the caregiver to be away from, I would not say, that immediate moment of trauma, can give him some, uh, can I call it a break from that, you know activity,
Load.
and or the load. And for the individual also, it's a new place, new setting, new environment, where a trained person is now taking care of him. That is something which is very good. Can you please touch upon
Yeah.
that?
So I'll explain it with an example
Yes, ma'am,
about
that'll be
one
great.
one person, one family that had come to us.
Yes, ma'am.
So this lady was about in her 70s. She was a Sanskrit professor.
Professor.
Yeah,
Hmm.
and she had a stroke.
Okay.
And her husband is again around 75,
Hmm.
and the couple are living alone. Both children are abroad,
Oh, okay.
right?
Okay.
So she was admitted to the hospital for some time.
Hmm.
She was almost bedbound, needed help with all activities, even getting up, going to
Hmm.
the toilet, everything she needed help with.
Yes, ma'am.
So they got discharged from the hospital and went back home. And they had a caregiver to look after in the daytime.
Okay.
In the night, the husband was managing her.
Okay.
So they came, 2 weeks passed, and this gentleman at 75 in the night does not get proper sleep
Sleep.
because he's worried about what is going to happen
His
to
wife, his
his
love, his
wife.
spouse.
Yeah, and also lifting her, taking her, sort of creates a lot of difficulty for him
For
as
him as
well,
well.
right? And because of all this, she developed because she's bedbound,
Bed,
she developed a bed sore,
bed sore.
right?
Okay.
That is when they came back to the hospital.
Mm-hmm.
And of course, that bed sore management did not need hospital admission.
Okay.
Okay, so that is when the hospital decided to refer them here.
Okay.
So they came here,
Okay.
and I think when we met him after 2 days, the one of the things that he said was, if for the first time in the last 4 weeks, I'm sleeping well,
He was able
because
to catch up
he
with
was able
some.
to catch up on his sleep, and he was able to sit with her
Yes.
and just spend
Talk.
time
Yeah.
talking to
Talking
her.
to
And
exactly.
he said, at home I am continuously doing things. I don't even have time to sit and have a conversation with her, which we used to have
Have.
before.
Correct.
Right? Coming here, I'm able to talk to her. I'm able to discuss things with her because I am less tired.
Yes,
I'm
ma'am.
less anxious. I know there is somebody to take care
Correct.
if things go wrong.
Correct.
And again, we showed him how the bed sheets have to be put to prevent further bed
Further.
sores. We showed him how she has to be fed, because feeding in a lying position, she may aspirate. So what is the positioning that is required when you feed her, and how to transfer her from the chair to
Chair.
the commode, and
Commode.
from the commode to the bed,
Bed back.
back to the bed,
Back to the bed.
etc., in the right manner, without straining himself, nor straining the
Patient.
patient. So these are small things that we don't realize.
Yes, ma'am.
Right?
Yes.
And that empowerment
Mm-hmm.
enables him to take care of her in a much better,
better.
with less stress on himself. We
Correct.
also had a conversation with the family, to the two sons who were abroad,
Okay.
over the phone, explaining what kind of care the mother
Mother.
requires. And they were not aware,
Okay.
because the father hadn't told, he didn't want to worry them. So he hadn't told the whole,
For
the whole
episodes that
seriousness
are
of the episode was, it's all fragmented information that was there with them. So we were able to put these things together in the respite care,
yes, ma'am.
having a 24-hour person to take care.
Correct.
So we empowered them to take care of her at
Correct.
home.
Correct.
And after 10 days, 15 days, they were, able. We
Able
also
to.
adjusted the medications so that her pain is better controlled. Right?
Correct.
And so these are all things that we did, and the bed sore healed also.
Correct.
Over a period of time, it started healing. So they were in a position to go back home and care for her better.
Correct,
So
ma'am.
this is the
Yeah.
concept of, respite care.
care.
Yeah.
In fact, ma'am, what you mentioned is in the Indian society, the way it is playing out today is very, very different. The kids are not aware, or I would say the grown-up children who are now abroad are not aware of the problems which are being faced by the parents back at home. The Indian culture is such that the parents will always want to protect
The
their
children.
children
Absolutely.
from information on how they are running their lives. They may be running it with great difficulty, but they will not portray or signal it to them. And at times the kids may not be aware also. And what I feel is there is one more aspect to it is, while taking care of that spouse, the 75-year-old person, something happens to him, then what happens?
Absolutely.
Because now both the parent
Elderly.
elderly couple
Yes.
are facing a problem, and the children are not there.
Yes.
So I think that is one more reason why the children should start talking to their parents in a more open conversation as to how they're running their lives once they have grown old. This is something which I would definitely request the viewers who are there, that they must speak to their parents whenever possible in a deep manner as to how they are going about their normal chores also. Hmm? Yeah.
And I think in addition to this, what we also did during the respite is what you rightly said, crisis management.
Yes, ma'am.
So the kids are abroad, right?
Abroad.
So who are the people the couple can call in terms
Yes.
of, in times of crisis?
Mhm.
List the 3 names
Yeah.
and have their phone numbers close by. Also talk to those 3 people and
Correct.
tell them we will reach out to you.
Correct.
Luckily, they had a very good support system.
Correct.
There was a neighbor who was very willing to help. There was a nephew who was close by.
Correct.
So listing out the names.
Correct.
And so the husband was, when you put
Correct.
those crisis plans in place,
Yes,
what
ma'am.
is the ambulance number,
Number. Yeah.
what are the
Yeah.
numbers,
Yeah.
all these things were listed out and given.
Yes,
So
ma'am.
it empowered. See, when you have a plan in place, you are
Exactly.
less
Exactly.
anxious.
Like what we do in the military is there is something called a SOP,
Yes,
standard operating
operating
procedure.
procedures.
So this is something which I believe that every person who has been in the services, because this we are primarily making for people who are in the services and their kids. So I believe that they have taken that to the civil part of their retired life and have put in SOPs
So
that
this
if this
for
happens, call this person.
person.
That is very important. And if not, if that such a mechanism is not in place, such a SOP is not in place, it is the right time to do so now. Ma'am, can you please let us know what are the facilities that are available in this hospice and palliative care?
Yeah. So as you can see, this place, it is around 12 acres of land, and we have just about 25% built up area. So
Okay.
it's more of green,
Serene environment.
serene environment, absolutely. And nature can be healing, and
True, ma'am. True.
that is
Nature has its
the,
power.
yes, it
Okay.
has a healing power, and that is a concept here. We may not be able to cure the disease, but the focus is on healing the person
Person
and the family and their reducing their suffering.
suffering.
So we have 100 beds,
Mm-hmm.
capacity of 100 beds, and we have currently functioning on 35 beds. But
Okay.
in April, that is in this year,
This year
we
now.
will open
Okay.
another 30 beds. So
Okay.
we'll be at a capacity of 65
65
beds.
beds.
Yeah.
Okay.
So 65 beds, and we um, we have doctors, we have nurses,
Nurses.
we have psychologists, we have physiotherapy, occupational therapy, speech swallow therapy,
Okay.
and so we sort of
It is a
provide
full fledged.
holistic, yes, full
So
fledged,
as it is as good as a hospital running 24/7
yes,
with expert medical
medical,
practitioners, medical staff, nurses available round the
every,
clock.
yeah, round the clock. But we do not have an intensive care unit, operation theater,
Understood,
etc.,
ma'am.
which
Got it.
is a hospital, what it is,
Yes, ma'am.
right? So
Yes,
this
ma'am.
is a step down from the hospital,
Hospital.
right?
Care facility.
Yeah, it is a medical
Facility.
facility,
Medical
which is
facility.
it's not a long term care
Care
facility.
facility.
Like people mistake hospices for old age home.
Yes, ma'am.
Yeah, it's not that. It's a medical
Medical
facility,
facility.
and there is a limited period of time where, as we mentioned, the respite care is for 2 weeks.
2 weeks.
End of life care, we can't keep time. It
Correct.
varies.
Correct.
So we are flexible there,
Yes, ma'am.
right? So that is how we run this. So if we have respite care beds, we have hospice beds,
Yes,
and
ma'am.
we have pediatric also for adult, and we have around 5, every block has 5 pediatric beds
Got it.
as well, because children also have chronic
Yeah.
illnesses,
Okay. Okay. So
right?
that
So
is,
yes, we have
yeah,
for them as
as
well.
well for the kids
Yes,
as well.
yes.
Okay.
So that is a basic structure of what we do.
Got it, ma'am. So if there is some person or a family who wants to avail this facility, so how should they be going about to avail this facility?
So as you are aware, this facility is entirely free of cost,
This
right?
is free of cost.
This is free of cost.
Okay.
We don't charge patients anything for the medications nor for the food.
Okay.
Okay, the relatives who stay with the patient may have to go to the cafeteria,
Canteen
and they have to
cafeteria.
pay for their food. But for the patients, everything is free of cost.
Okay, ma'am.
Right? We do not charge them anything. The
Okay.
only aspect is they need to go to the Kasturba Medical College. They need to go there to the Department of Palliative Medicine. All admissions are done through the Palliative Medicine Department.
Okay.
So there, the doctor will see them. They will screen for eligibility for admission here. And
Okay.
when I say eligibility, I don't mean economic eligibility.
Understood,
Right?
ma'am.
It is they need to have a
On a case to case
chronic
basis.
disease.
Okay.
It is the requirement, the physical
The
requirement,
requirement
or
of
the
the care.
psychological requirement for admission.
Okay.
Also, they need to understand that this is not a hospital.
Yes.
It's a hospice. That communication has to be there.
Yes,
So
ma'am.
once the doctor sees and feels that they need an admission to the hospice or to the respite center, they get a referral sheet from there,
Okay.
and then the patients can come here.
Come over here.
So we do not take admissions directly here.
Okay.
That's something that people need to
Need to
understand.
understand.
They need to go to the department, tell
Correct.
them there that we want to get admitted in the
Admitted.
hospice center. The doctor will screen, give them the admission
Admission.
card, and then they come here.
Got it, ma'am.
So that is the
My
process.
follow-up question to that is, what if some person is not undergoing treatment at KMC, Manipal, but at some other hospital? Can that family still avail this facility?
Absolutely. But again, they have to go to the
Both.
hospital, become
Understood.
an OPD patient,
Understood.
right?
Understood.
Register for the palliative medicine OPD,
Understood.
and then they can come. So I
Got it.
have patients who have been referred by other institutes,
Other
in
institutions as well.
as well. So we are in touch with the doctors also there,
Okay,
because they
okay.
have been under them for a long time.
Got
right?
it.
We touch base with them and talk to them
Got
as
it.
well.
Got
Yeah,
it.
yeah.
So I think our viewers should make a note of this, that it is not restricted to inpatients of Kasturba Medical College. If somebody is taking medication or consultation at any other facility or institution, they all they need to do is go to KMC Manipal Palliative Care Center, and then they'll be routed through this facility after due process. That is
Yeah.
how this facility
This
can be
facility
availed.
is availed. Yes.
That's wonderful, ma'am.
Yeah. So no direct walk-ins
Understood.
here. Yeah.
Understood. Because to be very honest, accepting people from other institutions, other hospitals, palliative care is a rarity, I would say. That is something I must say KMC Manipal is doing a wonderful job over there as well.
So we look at the need for the patient and the family, because it's a free facility. We have no revenue implications here at all. But what we want to emphasize is those people who actually need this facility should get it.
Correct.
And that is the need for the screening
Got
process.
it. Got it.
So sometimes people come with the mistaken belief that we may be treating cancer here.
Okay.
Right? We don't treat cancer.
Correct.
We treat the
People who
difficulties
are
that come out of
associated.
it. It could be the pain, it could be the breathlessness, it could be nausea, all the physical symptoms that come out of the disease, not the disease per se. Right? So similarly, the psychological aspects of it, those are the things that we manage here. So I think that understanding has to be very clear, and that is why the referral through the hospital.
Hospitals. Got it. And same would be the process for respite care also, that
Yes.
2 weeks or 4 weeks
Yes,
care that
yes.
will be provided.
Yes.
For that also,
The process
process
is
is the same.
Same.
So, ma'am, we have got a brief understanding of this facility, how to avail this facility. Now, how or when does a person or a family decides now may be the right time to avail or go and look at this facility for their loved ones? When it would be, how does one person decides the time frame when they should avail the palliative care?
So I think here we need to talk about the misconceptions that are there about palliative care, hospice care, etc. So there are certain things that has to be very clear for people to understand. See, one is you need to have a chronic disease, and there should be some issues like some suffering that comes with it.
Yes.
The second aspect is many people equate palliative care to end of life. Only when you have terminal, incurable disease will you go to palliative care. That is
Okay.
not the
Because
case.
that's my understanding as of now.
Understanding as well. So it's not the case. Palliative care begins at the diagnosis of a chronic illness, serious illness.
Okay.
Okay. So at the time of diagnosis itself, if
Okay.
there is some issue, physical issues, psychological issues, you can get referred to palliative care.
Okay.
So it begins at the diagnosis, continues throughout the course of the disease, during the end of life,
Okay.
and beyond that, because we look after both the patient and the family. So the bereavement care also is a big part of palliative care.
Okay.
Right? So the palliative care is the entire experience of the disease. You can avail palliative care.
Understood.
Right? When we talk about hospice care, it is a small part of palliative care.
Okay.
So hospice care starts when the patient is nearing the end of life. when the disease becomes incurable.
Understood. Understood.
Got it? So palliative begins at the diagnosis of any serious illness.
Okay.
So if in fact, if you or your loved one you think is having some issues, maybe uncontrolled pain,
Mm-hmm.
maybe breathlessness,
Mm-hmm.
extreme fatigue,
Yeah.
or getting depressed
Mm-hmm.
or anxious, these are all things that you can tell your doctor
Okay.
that, is there a palliative care team? Can we have a talk
Yes.
with them?
Yes.
Can you
Yes.
refer us?
Got it.
Right? So it goes concurrently with care,
Care.
with disease related care.
Management. Okay. This is
Okay, so that is why you have the set department of palliative
palliative
medicine
care.
and supportive care in the hospital.
Hospital.
So it goes concurrently with
Understood.
oncology, with nephrology, that is
Okay.
renal,
Yes.
with ICU palliative care.
Mm-hmm.
It goes concurrently. Together.
Okay.
Only when a disease becomes incurable, that treatment is no longer possible,
Possible. Then it
then
comes
comes the
to
hospice
hospice
care and
care.
they come here.
Okay. Got it. So in that, with this new information that I have received from you, so my understanding now is, ideally a person when they have been diagnosed with incurable disease, then they must approach a palliative care, so that not only they and the family also are guided on how to manage the situation in which they are in now.
So not all patients, because many of them are able to sort of navigate this on their own.
On their own.
Right? It's only
Okay.
some people who have
Difficulties.
and not at all points at different points in time difficulties can arise. So they
Understood.
can get support at that point in time.
Okay.
So not everybody who has a chronic disease needs to
Needs
come
to
in.
go.
So now suppose somebody has a probably hypertension. It's a chronic disease.
Got it.
You don't need
Yeah.
palliative care because
Yes,
you're
ma'am.
functioning normally. You just have to
Yeah.
take a
Got it.
medication, right?
Yes.
When it becomes a little more serious and complications starts coming in,
Correct.
probably that is the time that you need
Yeah.
to come in.
Correct.
So stage 1 cancer.
Yeah, that is what I was thinking,
Yeah.
ma'am.
So that person, maybe if they are very distressed
Correct.
and they're scared, maybe at that point they can approach or take help.
Correct.
But if they are okay dealing with it on their own, dealing well, and after a surgery you're completely cured of the cancer, you may not need palliative care.
Understood.
Right? So it is not about which stage you are in, what is the disease. It is about how much are you suffering?
Okay.
What are the symptoms? What are the psychological symptoms? What are the physical symptoms? What are the social aspects of care? What are the spiritual needs that are coming in? One common thing that comes up is why me? What have I done to suffer like this? Right?
Yeah.
So some patients suffer a little bit more than the others
Okay.
because of their
So that will be addressed by the spirituality part, which
spiritual aspects of
aspects of
the care.
care.
Yeah. So it's a need based care rather than stage 1, stage 2, stage 3. It's about
Need based.
Yeah. If the families and the patient needs it, then of course, please understand that there is a specialty like palliative care that can support you through your journey. Probably when initially things are going well, but over a period of time complications start coming in,
Yeah.
and the doctor says maybe treatment is not working as much as I anticipated. So sometimes you need to sit down and plan what to do. At that point there will be a lot of confusion, lot of distress. At that point, palliative medicine
care.
can come in and support. So it all depends upon the need of the patient and the families.
Okay. Ma'am, now we have spoken many aspects, including end of life. So how do you now get to an understanding that yes,
Right? They die in hospital, maybe in the ICU. And what kind of death do you think that is? In the ICU, families are not allowed
to
it can be very distressing for the patient as well as for the
families.
Right? So there are certain medical indicators that tell us this patient's disease has progressed so much that survival may not be for a very long time. So those patients we shift to end of life care,
Yes.
as you say. So what is it that we do? We look after all the physical symptoms. We try to keep patients as comfortable as possible. Right? Taking care of the pain. There are very good medications for pain. Given in the right manner, helps improves the quality of
Quality.
life and gives comfort. So first, most importantly, it is about pain management. The second most important aspect, or breathlessness, any physical symptom that is there, gets managed adequately with medications so that patient is comfortable.
Okay.
The second important aspect is about what they feel is their dignity,
Yeah, that's important.
right? They want to be as functional as possible,
Correct.
right? And that's a major area of focus. The
Yes.
physiotherapy, occupational therapy,
Yes.
you know,
Yes.
that's a major area that we keeping
Correct.
them as independent as possible.
Correct.
They need not be lying in bed all the time. Our
Correct.
facility is built in such a way that patients can, the bed itself can be rolled out into the corridors so that they feel the sunlight, they know what is day, what is night,
Right.
not bound in a box like
Yeah.
rooms,
Yes, ma'am.
right? So the ambience itself encourages that.
Encourages.
There are so many unfinished businesses or things that they need to say to
To
their
their loved
loved
ones.
ones,
Yeah, that
right?
is very
which
important.
which doesn't happen anywhere else,
Correct.
right?
Correct.
So what we encourage those
Encourage those.
conversations. Our counselors will sit, have these conversations with the patient and with the family.
Family.
And we have activities like legacy making, right?
Legacy making.
Legacy making.
What is that?
So that is you leave a legacy behind for your loved one.
Okay.
Like we, if it is a, like sometimes we take the handprints of
Handprint.
all the family members and
Okay.
create a tree,
Okay.
and that is
Okay.
framed and given in remembrance of
the loved one.
their loved one, when the loved one is alive, not
Yeah.
after the death.
Correct.
Right?
Correct.
So
Correct.
memory making, okay, and life lessons what that individual has learned, passing it on to the younger generation.
Yeah.
So there are different techniques that we use to encourage these conversations
Okay.
between families,
Okay.
which would never happen
otherwise will not.
Okay, some people have specific requests of what clothes they want to wear
Okay.
after death.
Okay.
What they have
Yes.
to wear.
Yes. Yes.
How how they want the position to be. Some rituals to be completed.
Yeah.
These are all documented, and we ensure this happens.
Correct.
So that the crossover journey, what we call, um, happens in peace.
Got it,
Right?
ma'am.
So many people think that end of life is okay, death happens
Yeah.
and it's over. But there's a lot of work that
Work.
we put in to make it a dignified process.
Yes, ma'am.
And we support the families in that grief.
Yeah.
The patient, the family. It is there is a lot of sadness, but there is also a lot of love in that, and peace in that space.
Correct.
So
Correct.
that's what we do.
Correct.
And this is a very important aspect of care as well. So I think we are all scared of talking about death and
Yes,
dying.
this is not being spoken
Right?
about. Yeah.
And like some of them will tell where they want the rituals to be conducted. The children don't even know, right? And how, which place they want it to be conducted. All that
Spreading
is
of
facilitated.
ashes, or
where it has to be done,
done.
where the homa has to be done, where the burial or cremation has to be done,
Correct.
how it has to be done. There are elders who have spoken about it to their
Correct.
children as
Correct.
well. And so these conversations are facilitated here.
Got it.
That is one part of what we do in the hospice care. One important part, this will happen only if the physical symptoms are controlled. A patient who's in pain will not be able to speak all this, right?
Correct.
So we encourage,
will not have that energy or the mindset to.
Yeah. So medical care, psychological care, we stitch the both together so that the quality of life is good.
When you were speaking about how this end of life is managed, what resonated with me was, being from a military background, is that the dignity. Okay, for us dignity is everything. How that dignity is managed, and also what type of clothes some people do have, because people have been wearing uniforms, their medals, they have the batons, they have the B caps, how that should be managed. These are all important information,
which unfortunately does not happen. So I think if there's one message that I have to give,
correct,
I think this is a holistic care that is provided here. Okay, you don't have to suffer alone. Most of the time, families, patients, they suffer on their own, not knowing where to go, what to do. I think this is such a institution has come up now.
Yes,
Please use it as much as you can,
absolutely.
and so help us serve you.
Thank you so much, ma'am. Thank you
Thank
so much, because we've had a very deep and meaningful conversation, which relates to end of life. Not many people would like to have this conversation. We have moved to that territory now because of many reasons, primarily because the demography of India is changing, and with that change is the associated fact that the children are not now living with their parents. They moved out from the city, from the country, and how to manage this situation is what we have discussed today with you, ma'am. Thank you so much for giving us your time, uh, and I hope this message we will try and communicate to as many senior veterans from the military and to senior citizens of this area and the nearby area in Karnataka as well, because this is a facility which can be utilized by them.
Thank you.
Thank you so much for your time, ma'am.
Thank you so much for
Thank you,
inviting. Thank you.
thank you.